Dr. Collins, thank you so much for your time. It's great to see you again.
Lori, it's nice to be with you. Glad to have a chance for this conversation.
So it's been about a year since this pandemic began. If you would please, sir, just at first give us your overall impressions about where we are right now. And in particular, if you could address so many of our Christian viewers.
Well, I'm a Christian also, so I'm glad to do that. It's been an incredibly difficult year, let's be honest. We've lost more than 500,000 Americans to this terrible virus as it has spread rather wildly through various communities, and it's not done with us yet. This virus, which came out of China and which had the really unfortunate property of being able to infect a fair number of people who didn't even know they had it, but were still capable of spreading it, which made it very hard to get under control. And we've learned a lot in the course of that year, and we've developed more effective treatments, things like monoclonal antibodies, so that people who do end up in the hospital have a better chance of survival. But we're still losing way too many people, especially those at higher risk, the elderly, people with chronic diseases. Here we are now, March of 2021, and I think one could say that there is some real optimism that we're going to get through this because of the ability now to be able to fight back against this virus, both with treatments that seem to be more successful, but also with vaccines. The vaccines, which I've had a big part in helping get developed, have been tested in the most rigorous imaginable trials. They've been shown safe and effective, and there are now 3 of them that have been granted emergency use authorization by the FDA. And we are now at the point where more and more people are getting immunized, and we have a good pathway towards getting almost all of the adults in the country the opportunity for immunization by June or so, which is our best hope of being able to put this pandemic behind us, and something that science has really pulled out all the stops in order to make that happen. And for me, as a scientist who's also a Christian, this is an answer to a lot of prayers, and it feels as if this is the way in which God is helping us get through this.
You mentioned the vaccines. Now we have 3 available. A lot of people are wondering which one they should take. What's your advice about that?
Well, my advice is to take the one that's offered to you and take it right now. The sooner we can get more people immunized, the sooner we can see the number of cases and hospitalizations and deaths head down towards 0, which is where it needs to be. We've had a drop in the most severe case numbers in the course of the last month and a half, but it's still stuck in a plateau at much too high a level. So we really want to push the vaccine efforts. Yeah, there are 3 different vaccines: Pfizer, Moderna, Johnson and Johnson. They all seem to have essentially 100% effectiveness in preventing hospitalizations and deaths. There's a little difference maybe in terms of their ability to prevent mild disease, but I think most people are mostly interested in severe disease. They're all really good at that. The Johnson and Johnson vaccine is a single dose, which some people will find appealing. You don't have to come back for that second shot 3 or 4 weeks later. But I think they've all been put through rigorous testing. I would be happy with any one of them. If you get the offer to get vaccinated, I wouldn't negotiate about which one, just take it.
The New Orleans Archdiocese came out with a statement saying that the Johnson and Johnson vaccine should be avoided among pro-life people because some fetal cell lines were used in its development and production. What's your response to that?
It's a very important issue for individuals who are very committed to a pro-life perspective to understand and to learn more about. And I saw that statement from New Orleans. I've also seen statements from the Vatican, which don't quite take the same perspective. So what is this all about? Basically, the vaccines that Johnson and Johnson is producing, there's another one by AstraZeneca, which is not approved yet in the US. They require that you grow the vaccine in cell lines because that's the way in which the production can happen. And cell lines that were derived more than 50 years ago are the way in which this is generally done. And these are cell lines that were derived from an elective pregnancy termination done in Scandinavia when it was legal at that point, and then turned into these essentially immortal cell lines that are grown in the lab by many different companies. Some people are, I think, troubled by the idea that the vaccine that's going into their arm had that history. It does not have any of those cells in it, but it has that history of having been used in that way. And I understand, therefore, why some will look at the Johnson and Johnson vaccine and think maybe that's not the one I would prefer to get. The Pfizer and the Moderna vaccines don't require this. They don't require any kind of cell line growth in order to be produced. Just the same, I think reasonable people will have reasonably different views in terms of whether this is something that a pro-life individual should avoid. After all, this is 5 decades removed from the event that we're concerned about. And certainly the Catholic Church, as represented by the Vatican, has said it is moral for individuals to take advantage of such vaccines if in so doing they may be helping save lives. And we do believe all of these vaccines can save lives.
So, do you recommend people wait and put, if they're offered the Johnson and Johnson vaccine? A lot of people might want to wait until they can get the Pfizer or Moderna one. What is your thought about that?
I think that's very much up to the individual. I don't want to insert my idea about what is a moral choice into the middle of something that's very personal. I think this is a circumstance people can learn more about simply by reading what's out there and then make their own personal decision. Whether this represents for them the kind of barrier that they would really rather not take advantage of such a vaccine as Johnson and Johnson, or whether considering the 5 decades that have passed and the fact that these cells are not in the vaccine, that that's an acceptable way to take advantage of something life-saving. Frankly, people should realize you're probably not going to be in a situation where you have a menu and you get to pick which vaccine you're going to be able to receive that day. Most of the time, clinics will be set up and they'll invite you to come. And I would be reluctant to suggest that anybody should just wait until they get the one they like, because that might be waiting a while. In the meantime, people can still get sick.
So, if you would please elaborate a little bit about the timing of this. Is there a need to hurry up and get vaccinated? Because we think about some of these variants that have been identified in the United States, particularly the UK and the South African variants. So, is time of the essence, or do people have the luxury of waiting until they get the vaccine they want, for example?
It's a great question, Lori, and I do think time is of the essence, and for two reasons. One is the virus is still spreading in most communities. That means people are still getting sick, 70,000 people every day in the United States, and some of those people are going to do badly. And if they were already vaccinated, that would probably not have happened to them. So just to save lives, the sooner we can get more and more people immunized, the better. But secondly, you raise the issue of these variants. We are watching closely as this virus slightly changes its spike protein coat, which is the thing that we're most worried about, because that can result in the virus eluding the response to the vaccines that we have planned. So far, we're okay. The variants like the South African variant, the British variant, the Brazilian variant, while they are troubling and they may be more infectious in terms of their ability to spread, they do seem to be those that the vaccine should still provide protection. So the sooner we get people vaccinated, the better chance we have to head off what otherwise could be a fourth wave of the illness from those new highly infectious variants. One other thing I might say is if we don't want more variants to emerge that might be even more troubling, the best way to prevent that is to get as many people immune as soon as possible, because the virus doesn't change its instruction book unless it copies itself, and it doesn't copy itself unless somebody's been infected with it. As soon as we can reduce the number of infections, we're reducing the chance of some other variant emerging that might be even more trouble.
So that's an interesting point, because so many people, particularly young and relatively healthy people, haven't been a bit too concerned about catching COVID-19 because they think, well, I'll probably have a mild case, perhaps rightly thinking so. But when you talk about the idea of variants, and even people who have asymptomatic cases or mild cases can contribute to these variants taking hold. It becomes a different issue, doesn't it?
You're exactly right. And if we really want to put an end to that risk, we need to spread this protective blanket of immunity across all of humanity. And of course, we're talking right now about the United States, but we need to think about the rest of the world too. That's the best way to put this virus in the rearview mirror. And that includes young people too, who may view themselves as not so much at risk if they get infected, but they could still keep spreading it. They could still be the place where new variants appear. So it's up to all of them as well to embrace the opportunity for a vaccine once it's offered to them. Most of them so far haven't had the offering happen because the way the vaccines are being distributed is focused appropriately on the highest risk people. And somebody in their 20s with no illnesses hasn't yet been asked if they'd be willing to roll up their sleeve. But that time is coming as soon as a month or two from now. And I think it'll be very important for all of those folks to say, yes, maybe this isn't altogether going to be critical for me, but it might be critical for my neighbors, my grandparents, for other people in the world who are depending on all of us to take part in this. This is a love your neighbor moment where we all have the chance to do something, not just for ourselves, but for everybody around us.
If you could elaborate on that a little bit too, from a Christian perspective, do you think that from a Christian perspective, does Jesus, for example, have an opinion about how we behave during this pandemic and even whether we get vaccines? Do you think that the Bible speaks to these issues?
I think the Bible speaks to virtually every issue, and that's where I often go when I'm trying to sort something out that I can't figure out on my own. And certainly, when you see how much time Jesus spent in the little we know about his earthly time doing healings, I think we were supposed to notice that healing was an action that we should try to emulate. And even Jesus sometimes used things like water and mud. Well, maybe that was his particular divine way of accomplishing a healing. We humans, as God's children, have been given the tools of science to kind of come up with our own way to work through God's grace to provide an opportunity to prevent suffering. And I think that's what vaccines are and have been all along. So, yeah, I think we're called to that. And I think, as you were going a minute ago, this is not just about sort of self-serving, I want to be sure I don't get sick. It really does come down to, are we going to take part in something that will help others around us? I think particularly of those individuals who have immune suppression, people who have cancer and whose immune systems have been damaged by the chemotherapy. The vaccine isn't going to work very well for those folks. They won't respond to it. So their best chance of not getting infected is not to be around other people who might be carrying it. Okay, that could be any one of us. If you think that somehow you're not the person that could do this, think again, and then maybe sign up for the vaccine. And oh yeah, by the way, wear your mask as well, because that's another way for the time being, until we're all vaccinated, we can keep from spreading this terrible virus.
Well, you talked about the case number being too high right now, too high for comfort. But can you switch and talk about the death count? We've seen that deaths are down, and we know so many people in nursing homes have already been vaccinated, and an estimated one half of people over the age of 65 have gotten at least one dose of the vaccine. Do you anticipate the deaths going back up because of those facts?
You know, it is encouraging to see the number of deaths each day has come down. It was as high as 3,000 almost every day back in January. Now we're down to about 1,000. But of course, that's still an incredible number of people losing their lives. One of the reasons it has come down, as you say, is because nursing homes where so many deaths were happening are now in the front lines of getting the vaccines. And you can see the results of that. Deaths in nursing homes have plummeted. But they're still happening in other places, and they are happening not just to people who are quite elderly, but there are lots of people in their 50s and 60s who are also getting sick and dying from this disease. It doesn't spare really anyone, even young people occasionally. So we're on the right path here in terms of seeing the death rate's starting down. The vaccines are helping. Maybe people's willingness to continue to follow these public health measures, even though I know we're all tired of them, of wearing the mask and staying apart and not congregating indoors without masks on. Maybe that's helping as well, although we need to double down on those right now. The concern, Lori, is that those variants that we were talking about, which may be more infectious, could turn this around. That one from the UK called B117 is doubling in its frequency in the United States every 10 days. And that kind of exponential growth is quite a source of concern. We need to watch that really closely. And our best protection against that is to do everything we can right now to get people immunized or to prevent them from spreading the disease.
Do you think people have a false sense of security because the case numbers and the deaths and the hospitalizations have dropped so dramatically since January?
I do think the dramatic drop encouraged people to think, okay, maybe it's finally over. But watch those curves. That drop, which was so gratifying for 3 or 4 weeks, stopped dropping. And now we're in this plateau where day after day, the numbers of new cases, the number of hospitalizations, the number of deaths is staying the same. It should be coming down. If it's not coming down, we should worry about that, and we should double down on everything we can do to change that.
We
I know
see
I
so
sound
many.
like a I know I sound like a downer here, and I know everybody is like, could you please just give us some encouraging news? Let me do that too. I think we're on a good path here. I think we're going to get through this. I think by this summer, life has a reasonable chance of getting back to something you would recognize as normalcy, where vaccinated people can gather together, take their masks off, and hug each other. But we're not there yet. And this would be a terrible moment to lose our momentum just when we can kind of see the goal line. If you're a fan of a football game, you don't want to see the guy who's carrying the ball stumble on the 15-yard line when you had a clear shot at the goal. That's kind of us. Let's not stumble, people.
So, once again, if you could make your recommendations, you already said people should get their vaccine as soon as possible, regardless of which vaccine they're offered. And can you again make your recommendations, especially again to the Christian community regarding the masks and the social distancing, which has really a lot of people have been resistant to up until now?
I know, and I understand all of the messages that have been spread around that make you wonder, wait a minute, is this really something that's based on evidence? Let me assure you it is. But let me also be sure to explain that I'm sympathetic with people who are wondering why they have to do this. What was it Theodore Roosevelt said? People don't care what you know until they know that you care. I do want to say all of us who are working in public health, we do care about the fact that this is an enormous burden on everybody and that everybody is tired and discouraged. They've lost family members. Their economic situation is in trouble. It's like, please don't give me another bit of bad news. But this doesn't have to be bad news. This is basically something that we, especially as Christians, can do to love each other, to love our neighbors, to try to do as Jesus calls us to be the best we can be in a difficult situation, even with suffering around us. And that does mean, yes, when you get the chance for that vaccine, take it. You're helping yourself. You're helping everybody around you. And yes, in the meantime, wear your mask whenever you're outside, because you might be that person who unwittingly is infected with no symptoms and yet are spreading it to others and putting their lives at risk. It's a simple measure. Don't listen to those folks who try to tell you that a mask is a political statement. It's not. Or who tell you that it's an invasion of your freedom. Well, okay, maybe like a seatbelt, but isn't that something you'd want to do if it's going to save somebody else's life? It's just a life-saving medical device. Use it as such and be grateful that we have something we can all do together to keep this from getting any worse.
When do you think we might have more vaccines available to the U.S.?
Well, the manufacturing is going up quite steeply now. Pfizer and Moderna announced a couple weeks ago that they had gotten some of the bugs out of their factory production, and they were going to be able to beef that up further than they had expected. So we should be in March getting to the point of 3 or 4 million doses going into arms every day, which is really the wonderful kind of trajectory to be on. And now with Johnson & Johnson getting also approved, they will add theirs. Already, the president has said by the end of July, we'll have 600 million doses. That's enough for 300 million people because it's 2 doses per person. That pretty much would get us there in terms of the adults in the country. We still don't have approval for kids. And you add on top of that the Johnson and Johnson doses, which will be 100 million by June, and that's 1 dose per person. I think if all goes well with the distribution, and if people are willing to roll up their sleeves and say, yeah, I want this too, we could be by the end of June in that remarkable place we call herd immunity, which is a terrible term that makes it sound like we're all cattle. But I'd rather call it this blanket protection of immunity so that this virus basically loses its grip on us and we get to go back to living the way we all thought we would be able to until this came along.
So, best case scenario, we may be able to throw away our masks by 4th of July, or is that too optimistic?
I think by 4th of July would be optimistic, but maybe that's achievable. And again, that means throw away your mask if you're gathered with other people who are all also immunized. If a lot of us decide, no, I don't want that vaccine, I'm not taking it, then if I'm around one of those people, I got to put my mask back on because I might still be the one to give them an illness that's going to make them sick. So come on, everybody, let's do this together. It'll be so much simpler that way.
All right, Dr. Collins, unfortunately, we're out of time right now, but we just wanted to thank you so much for, number one, your dedication and your service to the Lord, and also for the hard work that you've done as the director of the National Institutes of Health. So thank you so much for being with us today.
Well, Laurie, thank you. And again, I'm always glad to talk to other believers about this situation. And I cling to many of those scriptures that encourage me at a time like this. Something like 2 Timothy, where the chapter 1, verse 7, we have not been given a spirit of fear, even though it's tempting now to get fearful. We've been given a spirit of power and love and self-control. Let's celebrate that and give thanks to God that we are in that situation.
Amen. What a great way to end this interview. Thank you again, Dr. Collins.
Thank you. Many blessings.